Myeloma is the second most common blood cancer after non-Hodgkin's lymphoma. Joining us today to teach us more about this disease and treatment options is Dr. P. Harry, Chief of Hematology and Oncology at the Medical College of Wisconsin, as well as Jenny Ahlstrom, a myeloma patient who was diagnosed with this disease over 10 years ago. Thank you so much for being with us. Dr. Harry, can you first explain for our viewers what multiple myeloma is?
Myeloma is a cancer of the bone marrow. And since bone marrow makes all our blood, sometimes it's called a blood cancer too. It affects a particular type of cell in the bone marrow called the plasma cell. And the plasma cells make antibodies normally. That's their usual function. So when people get the COVID shot, for example, their plasma cells are the ones that make the antibodies. So when plasma cells get cancerous due to mutations or some other transformation that happens in them, then we get multiple myeloma in the patient. And it is a common disease, as you said. Unfortunately, it is twice as common among African Americans, and it is generally more common in older people. About 50% of the patients are above the age of 70 when they get diagnosed.
Is there a cure for myeloma, and how are patients treated for this disease?
So the main problem with myeloma is that it is a disease that we can control fairly quickly in the majority of patients. So we get patients into what we call remissions, but our ability to convert those remissions into cures where patients don't need any other treatment and they're basically free of myeloma for the rest of their life, that ability is very limited. So we still consider myeloma an incurable cancer. So in other words, patients tend to relapse over the course of time. So we always need new drugs, and we need new drugs with new mechanisms of action. So that's why this new drug is a big deal.
Can you tell us about this drug, Xpovio?
Any new drug with a new mechanism of action is something that is exciting to both patients living with myeloma and people like me who treat patients with myeloma. So our new treatments are all aimed at targeted medications like this one, and also now new approaches such as immune treatments for myeloma.
Jenny, you've been living with multiple myeloma for over a decade now. In the course of your disease, you started a nonprofit website as a community for other myeloma patients to come together. Could you tell us more about your medical journey and what motivated you to start this website?
So I was diagnosed in 2010, and at the time there was not, it's still considered incurable. It was especially more considered that 10 years ago. I wanted to be able to find an online myeloma specialist directory. So we built that as part of the Myeloma Crowd by the Health Tree Foundation. And you can find that on myelomacrowd.org. Now we have provided educational services. For example, we have Health Tree University, which is taught by over 95 myeloma specialists, and it's a whole curriculum about how to get up to speed on myeloma. We have a whole suite of tools and resources. And we built something that's really unique in cancer, is to any cancer, really. It's a website that patients can contribute their information, like even their whole myeloma experience, their labs, their genetics, their prior therapies, their outcomes. And then we can look at real-world evidence to help investigators like Dr. Hari come to faster and better conclusions for us.
Where can viewers go to learn more about this new drug therapy as well as myeloma in general?
So the new medication specifically is at xpovio.com, and it's known as XPOVIO. But to get a good understanding of all the medications in myeloma, they should visit Jenny's website, myelomacrowd.org, and also the International Myeloma Foundation or the Multiple Myeloma Research Foundation websites.
Wow, some amazing advances in technology there. Scientists truly are the new rock stars, and there's the details on the screen there if you want to find out more about multiple myeloma.